Welcome to Active Health 360. Your journey to a healthier, happier life starts here. Did you know that heart disease is still the #1 cause of death in the United States? According to statistics from the U.S. Centers for Disease Control and Prevention, CDC, every 34 seconds, an American dies from heart-related problems. What's worrying is that many of these deaths could have been prevented if only people had recognized the warning signs early. In fact, heart disease doesn't always manifest itself with severe pain or an emergency. In many cases, it begins with very subtle symptoms, like shortness of breath, unusual fatigue, or a feeling of heaviness in the chest. Many people think it's just stress at work, aging, or simply lack of sleep. But it's this subjectivity that causes heart disease to develop silently until it's too late. In today's video, we'll explore 5 early warning signs of heart disease that many Americans often ignore. Knowing these signs, you can protect yourself and your loved ones from the risk of heart disease, America's silent killer. So we can see that heart disease is not only dangerous, but also very subtle in the way it appears. The early signs are often so subtle that many people ignore them and continue with their normal lives. But it is this subjectivity that makes heart disease the scariest silent killer in America. Don't wait until the symptoms become serious to take action, because by then, it is sometimes too late. The important thing is that we recognize them early and act right from the beginning. So, what are the early warning signs that you should pay special attention to? Let's start with the first sign: unusual shortness of breath. Shortness of breath is one of the earliest warning signs, but is often overlooked. Many people think that just climbing stairs makes them feel out of breath, or walking a little faster makes them out of breath. It is due to lack of exercise or age. However, in fact, unusual shortness of breath can be an early sign of heart disease. When the heart is not working effectively, it cannot pump enough oxygen-rich blood throughout the body. This causes the lungs and other organs to work harder to compensate for the lack. As a result, you feel like you are out of breath, even when doing very simple activities such as walking slowly, climbing a few stairs, or even just resting. Some people also feel short of breath when lying down, forcing them to sit up to breathe easier. This is a very typical sign of heart failure. Unusual shortness of breath is not always accompanied by obvious chest pain. Therefore, many people are subjective, telling themselves, "It must be because I am tired," and ignore it. But remember, if this happens frequently, especially if it gets worse, it is a warning from your heart. Here's a tip. If you experience unusual shortness of breath, don't take it lightly. See your doctor for a heart checkup as soon as possible. Early detection and prompt treatment can prevent dangerous complications and even save your life. When it comes to heart disease, many people immediately think of a severe chest pain that causes the patient to clutch their chest and collapse. In fact, heart attacks are not always so obvious. In the early stages, symptoms are often more subtle, just a feeling of tightness, heaviness, or pressure in the middle of the chest. Some people describe it as something pressing on the chest, or a slight burning sensation. The most common cause of this phenomenon is a narrowed or blocked coronary artery. When the heart muscle is not supplied with enough oxygen-rich blood, the chest area will send out a warning signal. In particular, chest pain or pressure often appears when you exercise, climb stairs, carry heavy objects, or after a fatty meal. When you rest, the symptoms may decrease, but that does not mean your heart is completely healthy. In some cases, chest pain also spreads to the shoulder, arm, neck, or jaw. This is a very typical sign of coronary artery disease. Notably, according to the American Heart Association, women may experience chest pain differently than men, sometimes just a vague discomfort rather than a sharp pain. The important thing to remember is, any chest pain or pressure should not be taken lightly. If you experience it, especially if it happens repeatedly, see a cardiologist. Early diagnosis can help prevent a dangerous heart attack in the future. Fatigue is a familiar feeling to most people, especially in today's busy American lifestyle. After a long day at work, few people feel full of energy. However, If you always feel exhausted, even after getting enough sleep and not doing heavy work, it could be one of the early signs of heart disease. Why does the heart cause fatigue? The reason lies in the heart not pumping enough blood and oxygen to the organs in the body. When your muscles and brain lack oxygen, you will find it difficult to concentrate, lose energy, and even feel tired after just a light walk. This is different from fatigue due to overwork, where the feeling of exhaustion lasts for weeks or even months, regardless of how much rest you get. Notably, the American Heart Association, AHA, says that women with heart disease often show signs of extreme fatigue before they experience chest pain. This causes many people to mistake it for stress, lack of sleep, or psychological problems, and miss the golden time for diagnosis. If you find yourself in a state of unexplained persistent fatigue, don't console yourself with, "It must be because of too much work," or "It's because of age." Instead, take the initiative to check your cardiovascular health. Early detection can help prevent serious complications and keep your heart healthier. Another often overlooked but important sign is swelling in the legs, ankles, or feet. Many people think this is just a result of standing for long periods of time, wearing tight shoes, or eating salty foods. But in fact, it can be a warning sign that your heart is having trouble. When your heart weakens and can no longer pump blood effectively, blood circulation slows down. This causes fluid to build up in the tissues, especially in the lower areas of your body, such as your feet and ankles. As a result, you may notice that your legs are swollen, your shoes feel tight, or your socks leave marks when you take them off. This is known in medicine as peripheral edema and is a classic symptom of heart failure. Some people may also notice swelling that gets worse in the evening after a long day of standing or sitting. The danger is that because this symptom develops slowly and is not painful, many Americans tend to ignore it, thinking that rest will do the trick. But if left untreated, prolonged water retention can put pressure on the liver and kidneys, causing overall health problems. If you often experience swollen feet accompanied by shortness of breath, fatigue, or unusual weight gain in a short period of time, consider it a red alert from your heart. Don't hesitate. Go to a medical facility for a cardiovascular checkup. Early detection and treatment will help you control the disease more effectively, instead of letting it progress to dangerous complications. Have you ever felt your heart suddenly beating too fast, too hard, or skipping a beat? Many people describe the feeling as a pounding in the chest, or as if your heart is wobbling. This can be an early sign of heart disease, especially an arrhythmia. Under normal conditions, the heart beats regularly to pump oxygen-rich blood throughout the body. But when the heart's bioelectrical system malfunctions, the heartbeat can become too fast, too slow, or irregular. This is called an arrhythmia. Sometimes it only lasts a few seconds, making you feel indifferent. However, if the condition recurs frequently, it can reduce the heart's ability to pump blood, leading to fatigue, shortness of breath, and even an increased risk of stroke or sudden cardiac arrest. In particular, according to the American Heart Association, about 2.7 million Americans are living with atrial fibrillation, a common form of arrhythmia. It is worth mentioning that many of them do not know they have the disease until they have dangerous complications. If you notice that your heart often beats fast, irregularly, or feels nervous for no apparent reason, do not take it lightly. Note the frequency and time of occurrence and report it to your doctor. A simple electrocardiogram test can help detect problems early and provide appropriate treatment. Remember, a healthy heart is the foundation for a long and fulfilling life. So, let's learn about 5 early warning signs of heart disease that many Americans often ignore. Unusual shortness of breath, chest pain or pressure, unexplained persistent fatigue, swelling in the legs, ankles, or feet, irregular heartbeat, rapid heartbeat, or arrhythmia. It's important to remember that these signs are sometimes very mild, very vague, and you can easily brush them aside. But it's that subjectivity that makes heart disease the leading silent killer in the U.S. Early detection, early examination, and early treatment are the keys to protecting your heart and prolonging your life. If you or a loved one is experiencing one of the above signs, don't hesitate. Take the time to get a heart health check. Just one appointment with your doctor today can change your whole future. If you find this video useful, please like to support, share, so that many others can also receive this important information, and subscribe to the channel so that you do not miss the next videos about health and healthy living. Remember, there is only one heart, and you need to take care of it every day. Health is the greatest gift you can give to yourself and your family. Thanks for watching Active Health 360. Don't forget to like, share, and subscribe for more healthy living tips.